Welcome to the CHIP meeting. We will go ahead and call the meeting to order, and we will start with introductions. Is there someone on the phone line that wants to start?
Hi, this is Jillian Wiesenberg. I'm the director of the South Central Early Learning Hub, which is Lake Klamath and Douglas.
Oh, thank you.
I'm Nam Dave. I'm the clinics director with Lake Health District.
Okay. I'm Susan Plantier. I'm the revenue cycle manager for Lake Health District.
Hi, I'm Arvinder Singh. I'm the community health coordinator, Lake Health District, Lake County.
Hi, my name is Liliana Villanueva, and I'm the regional outreach coordinator for Josephine, Jackson, Klamath, and Lake County. So I have taken over Lake County from Maria Waters.
Oh,
And I'm Diane Clay, a consumer advocate.
I'm Daphne Greer. I am here from the South Central Early Learning Hub as a family resource specialist and also from Klamath and Lake Council on Aging as a case manager.
Hi, I'm Gloria Stringer with the Lake County Crisis Center. I'm the director there.
Michelle Cotton, DHS Self-Sufficiency Family Coach.
Gayla Pardue, Water Mountain Medical Clinic Manager.
Paul McGinnis, Eastern Oregon Coordinated Care Organization.
I always
Me?
make you participate.
Oh, my titles aren't as fancy as any of yours. No, I'm Michael Acosta. I work for the paper.
Christy Albertson, I'm the grant writer for Lake Health District.
Francie Winters, I'm the prevention coordinator for Lake Health District.
Ariana Asimar, here as a TPAD coordinator for public health.
Vanessa Marler, office manager for Advantage.
Ann Caston, Lake County Senior Center Transportation. Judy Clark, Lake County Public Health Director.
Did someone else join us on the phone other than Jillian? Could you introduce yourself?
And I'm Vanessa Singleton. I'm the regional hub visiting systems coordinator with the South Central Early Learning Hub.
Hi, Vanessa.
Hi.
Okay. Charlie just joined us as well.
I'm Charlie Twait. I'm CEO of the hospital here.
Okay, we will go ahead and look at the minutes. We do have July minutes that are attached to the back of your agenda. Everybody wants to take just a moment to look those over, and then we will entertain a motion to approve.
I would like to clarify one point on the Senior Center Transportation. We will be starting in October to provide for everyone, for anyone who wants to ride. Not just staff recipients. We're timing it for staff recipients, but everyone will be welcome to ride.
I move that we approve the minutes as written. Oh, with the change that Ann
As corrected.
submitted.
Is there a second?
I'll say.
All in favor?
Aye.
Okay. Minutes approved as corrected. Let's go over to Paul for our EOCCO and Godia, please.
You bet. Few things to cover today. It's nice to see so many people representing the early learning hubs as part of the meeting, and just wanted to point out that our next Regional Community Advisory Council meeting is dedicated to kids with partnerships with the 5 early learning hubs that cover Eastern Oregon. It's September 25th, Baker City. You're all welcome to attend that meeting. And we do focus exclusively on that partnership that we've been asked to form with early learning hubs around that. Although there's new emphasis in the incentive measures that you'll see that will tie us together a little better, but we lost one measure, the developmental screens for 2020, which also linked us together very tightly as well. And also having 0 to 6-year-olds assigned to a patient-centered primary care home were common incentive measures for both groups. The first thing I wanted to share is the Lake County report through June of 2019. You've seen these reports before. You know how it works. On the right-hand side, the far right are the number of members in Lake County who need that service in order for you to turn that red column green as part of it. We don't expect that there'll be a lot of green yet, given that time of the year, but you know, we should start seeing stuff moving fairly soon. The two that are at the bottom, we sent out some information on that one as well. They're not really incentive measures, but other CACs have asked that we track them. The first one where it says establish PCP care, the CCO was concerned initially when we started off about 48% of people who were members consumed no primary care services at all during the year. It's down to around 35% now, but we still want to see that trend going down. So when we look at the people who are assigned to patient-centered primary care home here, we still need 358 of them to come in for a visit this year. And that's important because if they don't come in, then how can you provide the preventive services that are part of the incentive measure? So that's that. And then the other one that you're green on is the morphine equivalence dose report. It'll just be there as long as we're trying to keep down the 120 morphine equivalence doses within the past 12 months. So just to track the importance of encouraging our plan members to use primary care.
Paul, do you have something written up, or could you easily send something that was specific about, about that, the PCP, the importance of the PCP care thing? And the reason I ask is because we just came out of this meeting and there were some people that were like, and they're pushing me. I'm like, wait, you need to understand why they need you to have a PCP person of record. And some of these people were official employees, and it would be great if we had something to send out and just let them know so they had an explanation.
Well, it's my understanding that if they haven't gone to anybody, they're essentially assigned to the highest rated patient-centered primary care home rating by tier. So, Nam, you guys are 4, right? Mm-hmm. You know, so the assignments go automatically to them. And then the expectation is when you look at this number, you go, oh, I better reach out to these people that are assigned to me to get them in.
Paul, do you know if we can have that automatic assignment process changed? Because I don't know if Dr. Graham wants to have more patients assigned to his practice.
We've just been working on case by case and starting to work out okay. As long as the ones that are assigned to someone else are getting the care, they're not having to flow over.
Right. But certainly the concern is that the district would be assigned all the patients when in fact they are going to other clinics. I want to make sure that we're being as fair as we can.
Well, if they go to other clinics and they establish there, they're moved.
Well, we have to sign on to do that, but we do.
Yeah.
Yeah.
Okay.
We can sign on as we see them and move them.
Okay.
What about North Lake? Where do they go? Because we're not the closest facility. So they go to Lapine or they go to?
They go to Lapine.
Ben?
Right.
No, it should be Lapine.
First by location, and
Right,
then
right.
by tier.
Okay.
But the North Lake Clinic is a patient-centered primary care home.
Right.
So for North Lake community members during 2018, 44.9% of the people had no primary care visits. For South Lake, it was 41.7%. And then if you remember that presentation, there was also an entire page that said what age and gender those people were who didn't go. So,
And it's not predominantly children that are not going.
No.
As you would expect, it's all ages.
well, here 32% of them in In South Lake, we're between the ages of 5 and 14, and 31% of them were 25 to 44. So generally, the healthiest cohorts. They just don't come in.
Well, we should stop that. Make them come in.
Well, it's
We
just,
can't get in.
that's why it's on the report. We just wanted to share that with you.
Shut up.
I mean, you can't get in.
You can't get in to see the doctor for 6 months. If you're healthy.
Well, why would you want to go see them if you're healthy?
Well, you said bring them in, yeah.
Right for the wellness exam.
Right? Yeah.
Exams that.
Then I end up at the wellness center.
So again, you'll see these reports monthly coming in now that we have enough data to actually have it make some sense. The next item in your packet are the changes to the incentive measures that the state decided for 2020. So we're working on the data for 2019 here to meet that to get paid next August for 2019 at your clinics. And still the LCAC dollars are tied to our meeting those 2019s, but I wanted to give you a heads up about what's coming for 2020, because some of the local community advisory activities that have been fairly successful in terms of bringing resources into South Lake and North Lake County have fallen off the board. So taking a look at the top, for our early learning partners, there's kindergarten readiness, preventive dental services, and it's good to see Advantage here as well. Are you local, or did you come down from Bay? Or
Local.
Redmond, okay. So kindergarten readiness, preventive dental, 1 to 5, and 16 to 14. So we're still trying to meet the sealants, the dental sealants in that one. Kindergarten readiness, well child visit, 3 to 6 year olds. This one puzzles me a little bit because if you get rid of, at the bottom, the developmental screens for 0 to 36-month-year-olds, which we hope people will still do, because if you can identify where a problem is in a 0 to 3-year-old, then you can do the wraparound services that are needed so that they can try to be kindergarten ready. If you wait for anybody to see somebody until they're 3, then you're already 3 years behind in trying to get them up to speed. But that's what they picked, and I'm not sure if the early learning people have any thoughts on that one.
I don't think we have.
This is Vanessa, and I'm unsure what piece of the packet you're looking at. I'm having a little bit of trouble hearing you.
It's the final 2020 measure set. It has the yellow highlighting.
Okay. And I know Jillian had texted me and said she was having a little bit of trouble with her Bluetooth. I don't know, Jillian, are you back on? Yes, I'm back on, but I'm in my car driving, so I don't have access to it. Can you repeat the question?
Well, I just was wondering what you all thought about that. I mean, obviously they're going to develop rules around it, but it's just basically called kindergarten readiness well child visit, 3 to 6 years old.
And we don't know any more other than that title, correct?
Nope. But, I mean, I'm assuming that there's some standards. I mean, the schools are the ones that have to do the actual kindergarten readiness assessment when they come into kindergarten. I think they have like 9 weeks to complete it or something like that. We did share that over several years in our community health assessment about what Lake County kids look like from 2013 and each year. And if you recall, the data got screwy because they changed the measures in there, so you really couldn't see a solid trend line. But if people are familiar with what a kindergarten readiness well child visit is, I'd love to hear it. Because I don't think our clinics are trained up for, doing that. There is the social emotional component of that, but are you really going to have, do you know if this is a big letter, a capital letter L and a little letter lowercase? and sounds? Do you do that stuff, or? Okay.
I think that the ASP.
Are you familiar with the Early Learning Division's Raise Up Oregon? They have a state plan where they had 9 months of planning with the Early Learning Division. They, with Oregon Health Authority, with Department of Human Services, with ODE, Department of Education, Early Learning Division, and Community Housing. And they also have been meeting with the governor monthly on a lot of these things. So part of it is getting ready for kindergarten. Part of it is for health and social development, and part of it is alignment and coordination. So I think that future conversations will be really helpful, but in that plan, which I don't have in front of me, there are certain things, and they have symbols as to what they recommend that Oregon Health Authority work with partners on. And so I think it'd be really great for us to look at the plan and then have conversations and then listen to what the state is sharing about how we can all work together. But there is definitely, I don't know if you've heard of it, Raise Up Oregon, and it's taken a lot of work over the last 1.5 years that Early Learning Hubs and their partners will be working on, including Oregon Health Authority.
I have seen the Raise Up Oregon plan. It's impressive. Hopefully there's some money behind it.
So I think there's some things in there that we can all work on together. So maybe at a future meeting, we can kind of look at the highlights.
Are there going to be some tools or aids that will be recommended to the primary care clinics to utilize?
Well, yeah, it would be,
that I don't know, but if we look, go ahead.
No, I'm sure there will be tools, like when not everybody was doing developmental screens for 0 to 36. We invested a bunch in the ages and stages questionnaire.
Right.
We gave tools to people. We came around and trained. So I'm sure that that'll be part of it once we understand the details. But go ahead, ma'am.
No, there's certain things that are in the plan. I don't have them in my mind, but they're kind of strategies. So what they have is they have the goals, and then they have strategies, and I think they're going to drill down deeper. And Oregon Health Authority is going to work with the Early Learning Division to look at what is possible. And so I think, it's in process. But I also, one thing I'd like to add is as we look at it, it's also something that we as local communities can also look at what's available in our communities, and then we can look at what we want to build on. I don't know how else we do it, except by looking at what exists and where you want to go from there.
Right. So this is just the initial reaction to what's going to be happening then. Timeliness of postpartum care will continue. The emergency department utilization for people who have a mental health diagnosis will continue, but the overall emergency department use by everybody has been discontinued, as you see at the bottom. So they just kept the one with the health disparity. The oral evaluation for adults with diabetes, that's new this year. It will stay. You can look at Lake for June of 2019. We've had basically 2 people have had that evaluation out of the 105 that are in that denominator. So, and that must be conducted by a doctor of dentistry. It cannot be an extended practice hygienist. So that, we don't know how we're going to do with that one this year. Cigarette smoking prevalence is, it was one of those ones that they introduced to clinics and just said, basically, can you produce records of your patients who use tobacco? The answer was yes, and then during the last 2 years, they've said, okay, how many can you get to quit? That's what we were thinking was going to happen with the one at the bottom of the page that went away, which was weight assessment and nutrition and activity counseling for kids, which was, they were setting us up to have us work on childhood obesity and actually try to measure a decrease, because all you had to do was say, yeah, we weigh and measure and tell kids to, 5 fruits and vegetables a day, 1 hour screen time, 0 sugary drinks or whatever. Depression screening, still there. These next 2, 8 and 9, kind of confuse me and maybe are clinic partners can help me understand better. Initiation, engagement, and treatment for drug and alcohol use. And then 9 is a measure that went away that's come back, which is SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment. So I'm assuming you got to do the screening, brief intervention, and referral to treatment, for drug and alcohol use. And then you move up to 8 if they say, I'm not going. And then you got to initiate, engage, and get them into treatment. Is what I don't know, help me out. What do you?
I would assume so.
Yeah, I would think so too. Probably them engaging with somebody that specializes in this, like recovery
That's
center
usually
here or
wellness, yeah.
wellness center, more than just a primary care provider is what I'm guessing.
Well, if they were doing the SBIRT and actually referring to treatment, that's where they were sending them anyway, right?
But in this case, it probably is them actually finishing their course or their time with the wellness center, tracking that second half. Are they following up on their treatment,
Okay.
not just the referral?
So anyway, that's a new one that we'll need to learn about. Childhood immunization status, we didn't meet it last year as a CCO as a whole. It's still there. They've added the adolescent immunizations for human papilloma virus. So we're talking before you become sexually active, sometime between 11 and whatever that is, looking for that vaccine for HPV.
Are we expecting that's going to be an expected immunization for everyone in Oregon?
For school?
Yeah.
It's not yet.
I understand that.
Right, but it is covered under the Vaccines for Children program. So, I mean, the
I don't
public.
see it being required. There will be a huge fight.
Yep.
I understand.
Yeah, I can't, it's not a herd, so I can't see them making it for school requirement.
Are you getting more pushback now than you were a year ago?
I'm getting the same, because Ariana and I are doing phone calls every day. We are busting down doors because, we were the lowest county. And I think we might be up one county. And that's a big deal for me.
Is it mostly in South Lake that you're
It's
getting
everywhere. It's everywhere. It's healthcare people here in the hospital that are against it. It has a lot to do with religion. It has a lot to do with sex was attached to that immunization. Therefore, their children are not sexually active, and by golly, they're not going to get that. It was the advertisement. I mean, we have people that work in our hospital that are giving it to the boys but not to the girls because the girls won't be able to have babies. It doesn't. I'm serious. And I've talked to you about HPV is a struggle for us, and we are working extremely hard on it. Education, 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 but people start dashing away from me when they see me because anybody who walks in the door, or if I see them walking by, I say, hey, are you up to date on your, and so this is going to be tough. It's going to be very, very tough.
Has there been a new?
We don't know what the targets are for any
Yeah.
of these. We can guess the ones that were here where it says target for one that was there, just add 2%, 2.5%, but.
Realistically, 9 through 14 is easier for us because parents.
Girls or boys?
For both, because parents will look at me and say, yeah, of course my kids aren't sexually active. Absolutely, we'll do that. When they get to high school age, that's mostly where we get more kickback because it's just, I don't know. People are different.
At that point, though, once they're 14, they can sign their own consent for that,
But
correct?
again, you have a parent telling you,
15.
no, kids don't want a
15
shot.
for immunizations?
I mean, you can't entice them by saying, come. I get a lot of, every time we have a reproductive health clinic, we look them up every single time, and I get a lot of girls saying yes at that time on their own. But you have to be real careful at school saying, during my reproductive health talk, I say you can come in at any time now at this age and choose to get what vaccines you feel are important. You don't need your parents, you don't need money, but if you have parents, I mean, kids don't want shots, and do you run the risk of making your parents mad at you over something that maybe you don't feel is important right now?
So have you seen anything from the state that is not attaching it?
Most all things, the advertisement is much better now.
Okay, because remember when I asked you about getting a group together, because they actually came and interviewed a bunch of us about that, and we said,
Right.
here's the problem.
Right.
It's that you attached it to
Right.
to sex, and if you hadn't, if you just attached it to health, you would have done better. So I thought maybe it wasn't enough.
We have
It was too
tons of
late.
information we give out.
Can't get the
Is it
back
good
in the box.
information?
Yep. It's good.
So,
But we're working at it. I mean, I'll be curious, they haven't updated our rates yet. They said it should be soon, we'll be seeing if we've increased. We have to. I mean, what gets us is they don't consider our rates until you complete a series. We have so many high schoolers that are gone now or in high school that needed 3 and they've had 1 that we'll never see again. So we can't get those completed. So what I'm trying to do, which is hard now, as you guys know, nobody has the same phone number anymore. I'm trying to contact people and say, have you moved out of the area so I can take them out of my system. But that's hard. I spent 2 days on it and I got 2 people. So how much time do you put into that? I don't know.
Anyone have any suggestions?
You need an intern or a volunteer, but they have to be cleared to be able to do that.
I have one who's doing that, who's trying to track down phone numbers for us, yeah.
That's-
so the last 2 are still the assessments for kids in DHS custody. We've met that measure every year since 2013 until last year. We did not meet it.
As the CAC or as
As a region.
our region?
Yep. In 2018, or 2013, there were something like 53 kids in DHS custody, and then in 2018, there were something like 300 and something.
The state just added 300 positions for DHS across the
For
state
foster
in order
workers,
to
yeah.
try to take care of the.
And they're trying to bring a lot of the kids back to the state instead of going over to Idaho.
Or Utah.
Or Utah.
Yep.
Or California, where a lot of kids have been sent.
So diabetes control remains, so these 13, we haven't been told how many we're gonna have to meet to get 100% of our withhold back. Last year, it was about 12.6 million, and we got 100% back, which I'll share with you in a second. You're gonna be, Lake Community Advisory Council will have this year $41,190.
How many people are in this room?
So the problem that those of us who are close to this see is the ones that got retired at the bottom were things that were in a lot of the plans that the LCACs did across the region. Right? They were targeting those things. So if the application were exactly the same as last year to this year, and it said you have to spend money on targeting measures, and you had to do it on these 13 measures, it would be more difficult. There's less community involvement in those 13 than there are at the ones at the bottom. Where adolescent well care, developmental screens, where we can, lots of partnerships that can go about doing it. So we're trying to make sure the language is broad enough that it says that if you wanted to keep trying to keep inappropriate utilization of the ED, because that's still a good thing to do, that you'd be able to use your LCAC dollars for that. The other thing that you should know is that there's going to be 2 phases of the grants this year. The first one is going to be the LCAC at first, probably have the application middle of September, right? And then that will all be reviewed, and they're still trying to decide which ones of these they're going to create opt-in projects for, which you've applied for, Christy, several opt-ins. The adolescent well clinics were an opt-in.
So we are going to be applying to the LCAC, not knowing what the opt-ins are, but there might be opt-ins that sorry, that's
True.
just.
No.
Paul, are we gonna know anything about?
We'll have a good idea next week what the opt-ins are.
Will we have any idea if there's any money specifically for dental? Or is that something we just think about?
Specifically for dental. So the contract that we have with ODS and Advantage, the actual contract gets them resources back if they meet the sealant measure, the diabetes measure. So they're rewarded like primary care is. At first it wasn't though. At first it was just the CCO board said they did all the work, here's a check for $700,000. But now it's actually written into their contracts.
The reason I ask is certainly one of the things that was brought up is diabetic patients and bleeding gums and that correlation.
Right.
And so we talked about how, prior to you being here, how we had a couple factors. 75% of the patients that are in the CCO go to see a primary, or have a physical health contact. 25% don't. And it was the opposite for dental. 25% get care, 75% don't. Then the second part is the diabetic patients that we have, and we have quite a number. We want to get all those patients in to be seen by a dental practitioner, especially if they have bleeding gums. So we want to work as closely as we can. We talked about how anytime a patient goes to a dental clinic, one of the questions would be, have you been in to see your practitioner? Same thing would hold true in the clinics. We want to ask every one of our diabetic patients, have you been in to see a dental practitioner?
Just like you do with foot care and other eye services.
We want to make sure that we have ample incentive on both sides of that service area to make sure that we are touching people as much as we can and finding out problems before they become big issues. And if we have money to help align that interest, that we're doing that.
Well, if you can figure out an alignment, that would be a new idea project that you could apply for. That money's still there.
So maybe we ought to think about
A pilot project, new idea, something like that.
That deadline is September 3rd.
Well, it's every 3 months though.
Okay.
That's the rolling application. So whenever you come up with a good idea, the worst you have to wait is 3 months.
Now, I don't know if there's other correlations besides diabetes, but of course diabetes is such a horrible situation and something we all want to really focus on. If there is some way of helping diabetic patients by ensuring we're getting them in to be seen in a medical setting as well as being into a dental setting, then we ought to think about incentive opportunities to do that.
We have a diabetes support group, and they have guest speakers, and that would be a start, getting them to bring someone in there. And
You know, one of the things we certainly found by incentivizing new moms, or not quite yet new moms, pregnant gals, that if they do certain number of things, we give them a Bob stroller. And there's a lot of things that we ask, and an important part of being pregnant is to have your mouth checked for any problems. Okay, well, at least we're getting one portion of the population, and there was an incentive. If we could set up some way of correlating dental care and physical care for our population that has this horrible condition, maybe that's something we could really make a difference on, or at least for those that are diabetic.
Will there be the restriction on using those CAP funds for the Living Well series, the diabetes support group specifically? Because if we have two different measures focused on diabetes, it would make sense that we might go after some grant funding to help.
Well, you could use LCAC funds, or we'll see what they come up with the opt-ins. But I'll have a pretty good idea next week, I think, where people are at least initially thinking. So I didn't want to take it too long.
Sorry.
So just know that lots of change coming in terms of 2020 for all the CCOs. The next page.
Only one question.
Sure.
So again, we don't know what will be available with the opt-in grants.
We do not know what subject matters they're gonna pick.
Okay.
But they're likely to be out of those 13 at the top and not at the bottom, which they've had a lot of money invested in that, over the years. I mean, we've done the adolescent well visit thing here for 4 straight years now, right? 3? Well, I doubt they're gonna wanna promote that, even though we still want adolescents to get in.
Yeah, and same for like colorectal cancer screening.
Yeah, we're on year 3 of that.
Yep, CRC, yep, that's gone too. That was a big community one, because that's kind of a norming thing with Nolan and Colin and, have you been screened? The next page is just for planning purposes, mainly for Christie and people putting grants together. It's our members by age and zip code in Lake County. And then at the bottom, it's where people are assigned.
Where's Weeks Family Medicine?
Yeah, I don't know.
Okay.
Well, it may be in Lapine or Bend, a small shop that, people from, we have contracts with all those providers, so. Just know that date is there. If you want different breakdown, for instance, if you wanted to look at how many kids are actually eligible for that HPD, we could get you that too, and, kind of know that we can mix it up. The last 2 documents deal with the administrative support function for the LCAC. We need to vote on, Weeks is in Bend?
Yes, it is.
So they're Lake people who signed up there, is what happened. Okay. So, Charlie, we're gonna need to have this form filled out for the admin support dollars and voted on at the next meeting in September so that you can get money by the end of the month. We're expecting that it will be up to $12,000 rather than up to 10. And then in the expectations, there's a little bit of change, a little bit of change there. And I spoke with our vendor about it. In this CCO application, when we applied for 2.0, they reviewed it, and we were admonished to do a better job of making every agenda have a public or member, OHP member comment time on the agenda, to get it posted to the web at least a week before the meeting, and to get the minutes posted as well so that people can follow on. We haven't been doing as good as we should. The other thing that we got nailed on was the number of EOCCO plan members who are part of our local community advisory councils. So that's part of our effort overall. But we're going to need to have this kind of thing, this form ready to go and to vote on at the next meeting.
Okay, we can get that done.
That was all I had.
We'll get it out a week before.
Yes.
See, Diane, we need more people like you here. More community folks representing.
Round them up.
I'll work on it.
Put a fire under
Well, hey, Nom, do you have what do they call them? Patient,
We have a patient and family advisory council.
right.
We do have that.
Are there
And we
any?
are still recruiting members for that because we are struggling a little bit with more community representation.
Okay.
That's 2, but we might be able to find one off of there that would attend this and kind of do both.
So we have one already.
And you don't want just anybody, you really do want somebody that's going to be passionate and stuff.
Well, when you start looking at some of the things like VHS, if there's foster parents that you know in the area, they're eligible for that. And if you weren't aware, for Oregon Health Plan members to attend this meeting, we pay a stipend of $35. We'll pay child care and transportation for people to come and participate.
We need to do a bigger push.
Yep,
We'll work on that.
that's all I have, Madam Chair.
Okay, thank you. CHIP updates.
Thank you, Susan. So I'll start the updates with the Living Well classes. So we are in the 4th week of the Chronic Conditions Living Well class. We are seeing a really good turnout. We had expected a low turnout because of summer, but surprisingly it's been really good. Even for today's class, we had 10 participants for the workshop. However, we are out of funding for the chronic conditions and the diabetes aspect of the Living Well classes. We have some funds left over for the chronic pain, but we don't have for chronic conditions and diabetes. So we'll see how it goes in the future. Next update is the summer food program. Lunches are going fine. It has slightly slowed down compared to June and July, but we are still averaging around 80 lunches. Yes, and our numbers are, if not equal, I guess more than last year's. And that is after that we only have 2 sites this year compared to we had 3 sites last year. So definitely more of the community is aware about this program, and they're taking part. And also, with the lunches that we give out every day at the 2 sites, we also support if there are any week-long summer camps. So far, we also provided lunches to a Lego camp, which happened in July at the OSU Extension Office. And we also provided lunches to the Bible study group. And we will be providing lunches for the next 2 weeks to the kindergarten camp, which is going to be at the ADA Fremont.
Any idea how many will be in the
yes.
kindergarten class?
Yeah.
Or pre-kindergarten?
Yeah, so for now, they have asked us to provide 40 lunches. And then we will see how it goes. Usually there's like a few lunches increase or decrease with every camp. And also with our summer food program, as we had planned earlier this year to do movement classes, which was for the weight assessment measure. So we have started doing that. This is the 2nd week of movement classes that we conduct on the site when we hand out lunches. And these classes are conducted by Mr. Rob Owens. And it's fun. We also give them some giveaways if they attend the whole class. And yeah, we are seeing a really good turnout for that also. I think it's close to 15. Hopefully they stay. Next update is about the Sir Optimist Park play structure. Last meeting, I think we had mentioned that we are very close to purchasing the play structure. We know exactly what we want and how to go about it. However, there has been a slight setback with ordering the park play structure. So there have been a lot of transitions at the town of Lakeview this year, and also a lot of people have transitioned into new roles. So there was a letter of approval that we were searching for, which was provided to us from Pacific Power, who owned the park. So we weren't able to find the letter of approval. So right now I'm in the process of getting a new letter of approval, and once we have that, it shouldn't take long for us to place the order for the play structure. Next update, yesterday we had a very productive food resource meeting in this same room. We had representatives from Lake and Klamath Food Bank present here. One of the many things discussed was how the Lake County Food Share is mainly run by volunteers. And also these volunteers are mostly older adults or seniors. And there was a concern that there's a challenge recruiting new volunteers or younger volunteers. And the concern was that who will, once the present volunteers are too old to work, who will we pass on the mantle to? And also food share, I think it definitely needs more advertising in our community because it's a very important resource, which we take for granted, I guess. So I just wanted to have a small discussion of if there are any ideas of how we could recruit new volunteers. Of course, one of the main challenges is that it's a volunteer job. Some of the ideas that have come up is to build a relationship or a system with the high school, so that there are students who do need community service hours or credits that they need to complete. We could either set up a system of that sort. I'm also open to any other ideas if anyone has.
Rod suggested connecting with the LDS church, was that for this? I think so.
I guess.
Yeah. Since
So just
community
all the
service-
churches?
Well, the Mormon church specifically,
Okay.
because service is built into
Okay, yeah.
what they do.
I'll make a note of that.
Oregon is like third or fifth in volunteerism according to the Vista site, or the AmeriCorps site.
On the top end or the bottom end?
The top, and the top end. And what was interesting and surprising to most people was 28% plus change, whatever, was a millennial rate of volunteerism, and 31 was the baby boomer rate of volunteerism. So just to let you know that the millennials are definitely volunteering. We should not write that off. Maybe hard for us to find them in our town, maybe. But
I was gonna say, I don't know where they're going.
Yeah, really.
Well, it's, you know, other food banks have that same problem.
They do.
I can't remember her first name, but her name is Knox, Knox, that runs the Oregon Food Bank. She spoke to the Regional Community Advisory Council and talked about that being a problem throughout Eastern Oregon.
So what are they coming up for solutions?
For money.
Well,
Somebody threw
you know,
out-
the conversation kind of was different. It was like people went from that to the, you know, thinking about the Shriners. You know, they do a great job. They have a lot of corpus money people have given to it, and that runs the Shriners Hospital, no charges for, you know, children in Portland. There's a rehab hospital run by the Elks in Boise, and, you know, they have money, but they don't have people. You know, there's not new people joining Shriners, and while the millennials will volunteer, they do it like on an immediate basis, you know, with an application rather than committing to something that's gonna tie them up over time. So there are, you know, we're gonna clean up the river on, you know,
Right.
next Saturday, and people will show up, you know, but it's not saying, I'm gonna be every Tuesday to carry boxes from a truck to a storage facility somewhere. So I think it is problematic. I'm curious though, high school kids have to do community service?
They
Do
don't have to,
probation.
depends if they're in a program that they want, you know, if they're trying
Honor
to,
society
yes,
or-
if they're, it's a limited amount of kids who need
Leadership
help.
class,
Yeah.
4-H, Honor Society, 4-H, FFA.
Yeah.
Oh, okay.
Have we considered possibly asking some of the other volunteer organizations in our community, so like maybe each of the fire departments take one day, once a month? You know, or Lions or Sir Optimus or something, and so maybe each group is more of that, hey, we're gonna do it on one day of this, you know, and everybody takes, you know, one.
That's how we did the
Event.
food program last year,
Right,
right?
that's how they, you got
And
it.
that's why we're not doing it again this year.
Why? Because it was too hard to coordinate?
Yeah.
And if they didn't show up, we were in a hot mess.
Okay. So I'm just curious, did I miss Brooke's replacement during introductions?
She's in Portland
Okay.
orientation. She'll be there for the next CHIP meeting, but she's already here.
Okay.
One thing that was discussed yesterday is maybe the possibility of getting some grant money. For like a part-time person who could coordinate and recruit more. Because I think, so even me, any of my TANF participants, I ask that they help, and we're gonna do it more regular. But we do with the actual food share, which is the Easter, Thanksgiving, Christmas, and I received a huge amount of pushback when we started that, and I was like, well, you access the services, so why not give a little time? So I think that's important because they need to learn that there is a lot of hard work and money that goes into it. But, you know, I don't know how else to do it.
Is there an opportunity to do work experience? I know sometimes the schools will offer work experience for credits.
So that usually is paid though, I think, so that's.
Well, the kids aren't paid, they get credits in school typically.
Some are.
I think they get paid, yeah.
Some are, some aren't, depends on where they work, yeah.
Honor Society students always see projects because they've worked with us sometimes with the crisis center. And then yesterday at the food share meeting, they also, Nikki from Fruit Share in Clement, she offered, I think, $1,300 for Lake County to use for the food center to use to advertise, either via TV commercials or whatever media the senior center decided on.
If we have matching funds.
Right, and
And Andrea approached me this morning about that and said, what do you think? And I said, we do have, my department has video cameras. So she's like, okay. So we'll see what happens.
Michelle, what group are we in? We were just in a meeting that I think, I know, which one was it? That somebody brought up, it might have to come down to businesses volunteering their employees a couple hours a week to help run these programs. And it's a goodwill basis that 2 hours a week, your employee will go and do that or something. I can't think of which
remember what meeting that
group we
was
were
too, but it
in.
was a good idea.
But that was one of the things they talked about.
Didn't our vendor try that last year with the meals though, and people would rather pay to have someone else do it than.
But this is, this was the employer saying, this is your job today, you'll go down there and work 2 hours.
I know the bank is, the bank was good at that.
Yeah.
I think maybe that's how it came up.
Yeah, maybe
Because
that's
somebody
where
that was
that
already doing it, yeah.
I don't know.
Wait a minute, is that billable? Sure, it must be. Community involvement.
It's just really a struggle because the food bank does have so many requirements. You really need one person who knows what the rules are and who can tell everybody else to follow it because we really want to improve that relationship and move forward instead of backwards, so.
Hi. So I was just, so one of the things that I've seen in my community that's worked with food banks is that they'll ask the church to host a food bank day, so like one Saturday a month, and it's through their own community within the church, and they'll bring the food to the church, and they'll have like different sections, and they'll teach you, like if you have like beans, they'll teach you how to make the canned beans with a different food, and it's like their own people that are coming in, and it's become very popular. So now they go to every other church, and every church has their own food bank day, and you can also kind of convince them to come and volunteer at the food share place because they're doing it already for their community. It's a great way to connect them to volunteer work.
So I'm trying to figure out, you're saying that it's a movable feast? The food at the church, it moves around? Or
no, it's like
every
they bring
month
the produce once a month.
To numerous churches? So it is movable, so people have to keep track of where the food bank
we did that
is?
before and it didn't.
No, it would be hosted like, let's say, the Catholic Church, for example.
Okay.
Like, say,
Then the next week it would be at the LDS church, and then the next week it would be at the Methodist church, is that what you're suggesting?
well, I mean, it works with one church in particular that dedicates that, like every
Like the site would stay the same?
Yeah, dedicates the site, it doesn't move. They open it to the community too, but it's more for like themselves, the religious community. And then they invite their friends and so it's known as the place to come get food like every Saturday.
So they wouldn't allow that. That kind of like County Food Bank wouldn't allow it because that church would have to get inspected and be approved. So.
But maybe they'll do it.
Oh no, based on the meeting we had yesterday, absolutely.
That was
We're
voted
gonna be
down
lucky
real
to get
quick.
one. Yeah.
Like
Yeah.
one church too.
No, Actually, it's a facility that the hospital owns and graciously allows food share to use, and we're trying to
Yeah,
get
for the warehouse.
the pantry to be there as well. But,
So that's where you could have the volunteers alternate?
yes, yeah, that's the goal, yeah, to have like a central place. And a lot of us are the same volunteers that do things. So sometimes it's easier for us if everything's in the one spot.
Right.
We can utilize our time better. So.
Additional updates?
That's all the updates I have. Thank you.
Christy, do you have grant updates for us?
Oh, sure. First, a quick update about our adolescent welfare visit grant. We asked for additional funds from the OCCO for effective contraceptive use to address that incentive measure. The original plan was for public health to be at our team health fair events and to just have information about the reproductive health program, not throwing condoms in the air, just information about what is available at public health. But that is not going to happen. And so Judy and I met recently to talk about what we might be able to do instead. And Judy has some funding from the state that's going to allow her to host events at public health, bring kids in, let them see this is everything we have available, not just reproductive health, but all of these services. This is what billing looks like. This is your right to privacy and how, if you need something, and you're on your parents' insurance, you have different options. So I have a call next week with St. Curtina to talk about if we can maybe supplement that. We don't want to supplant any of the dollars that she already has, but maybe in addition to 2 events in Lakeview at Public Health, one in Paisley and one in Christmas Valley. We could do extra events at maybe one at the library to try to catch some of the kids who are hanging out there after school. Judy pointed out that's probably a good place to reach some of those EOCCO kids because they're hanging out there because they don't have computers at home. They're the right demographic we're trying to reach. KCC has agreed that we can have an event there too, which might catch some of those, yes, some of the 18 to 21-year-olds, but also just some of the women who might not be coming in somewhere. We might catch some of the older ladies. So that's the game plan moving forward with that if we get the blessing from the OCCO. And we're swimming in Outback Strong swag, and so we have dollars we can move around in our budget to make that happen.
Christy, question for you. Maybe, whether you know or maybe everybody else knows. How many places do we have where there's public Wi-Fi, where kids can come after school and use Wi-Fi besides the library? Is there any place?
We have.
Not that I know of.
We have
The courthouse.
I think like Pizza Villa, maybe, just
Cycle
Pizza
Town.
Villa. It seems like maybe some of the
Cycle
little
Town.
restaurants do.
Cycle Town.
Wi-Fi, but not a computer for them.
Yeah.
But not a computer?
Yeah.
Right.
Yeah.
Have you ever thought about trying to create a student-friendly or youth-friendly place that has Wi-Fi, where we have some computers that are accessible, but we restrict the inappropriate things so that we don't have that kind of stuff going on. But if you find places for kids to go to, then maybe we could find places to give them information.
Yeah. No, this idea has come up a couple of times and great ideas, and next thing I know, those ideas disappeared. And Heflin had one of them, and somebody else had one of them, was going to put it near the Eagles Lodge. It's like, I just never saw them materialize.
Funding is, funding kills those things.
Well, and like the Marius building, we have a great building that has lots of open space. We don't give out our Wi-Fi password, because we don't. So I don't know if you even can. I don't. Yeah, right?
We have two. We have a staff one and then we have a guest.
Yeah, do we?
Like
I don't
motels
think
do, you know?
We have a guest, we don't have a guest, yeah. So, you have all upstairs, you have downstairs in that little waiting area. Kids could certainly come hang out there. I'd love to have them there. But that's not something we've been able to offer that I know of.
And there's a cafeteria upstairs, well, sort of. So there's a place for computers and everything.
Bring them our way. We want 'em.
Maybe that's a creative idea under EOCCO, a way to give them information and we put on automatic things against alcohol, tobacco, or whatever we're going to do that educates them on the computers and we haven't access to them. That's our carrot.
Sorry, never mind.
Second update, the Oregon Office of Rural Health has an Elder Services Innovation Grant opportunity. They're going to award up to two $7,500 grants to rural places. And Klamath Lake Council on Aging is going to go after this grant for the Village program in both Klamath and Lake counties. The thinking is that they would put this money into a pool, so a senior who needs an air conditioning unit or a grab bar or a ramp would have the funding to actually buy those materials. So we'd be able to match them with the volunteer, but that's not going to do any good right now if we don't have funding to actually help them buy the stuff they need to stay in their home. So Kim Estes is working on that, and she'll have to turn in the grant by the end of August, and we'll know by the middle of September whether that one gets chosen. So that's a good one. It's a pretty straightforward grant process.
Is your fire department paid or are they volunteers?
They're volunteer.
Volunteer.
We have a couple of paid dispatchers in town that typically is volunteer, but a lot of them do go in, do smoke detectors or change things out, or they do
Yeah, I know
in the
that
different areas of the county.
It's a district over in Florence, and I know that they went into people's homes and did the assessment for elderly falls and then lined them up with stuff, but that was, they were being paid.
Yeah. Final update is regarding the RCORP, our opioid grant from HRSA. We are going to be requesting an extension. Our grant period is supposed to wrap up September 29th, and we are nowhere near being able to complete the project by then for a lot of reasons.
But this is just for a plan, right?
Yes.
Okay.
Correct. Quick update, so originally our plan involved Lake Klamath and Modoc counties. Modoc County was awarded their own RCORP planning grant in May. They have been calling in and participating to some extent in our consortium meetings. They didn't tell us they were applying, they didn't tell us they won the grant. So Modoc County is no longer part of our consortium, and we're working just with Klamath. We have one or two partners in Klamath who are really good about participating, but it's the same there as it is here, where we just don't have the capacity with the people we have now to meet all the deliverables. So we are going to be asking HRSA to approve an extension with a budget revision where we can actually hire somebody who is going to essentially be the project director, or we calling them the coordinator, the project coordinator, who will help us kind of wrangle the troops. On the Lake County side, we've met a little bit to talk about a needs assessment, which is one of the deliverables we have to do, and to start some strategic planning around it. We also have to do a workforce plan, and then at the close of the grant, we have to do a sustainability plan. None of that work has started in Klamath. So this person would be splitting their time between the two counties, helping to coordinate, bring team members to the table to help figure out the different pieces for these plans, and would help me at the end when we're trying to combine the information from both counties into the final deliverables that we have to give to HRSA. We will know, we have a call next week sometime with our program officer, and we'll submit our application before the end of this month. And I'm hopeful. I mean, we have a lot of unspent grant dollars, and HRSA wants us to spend that money, because if we have to give it back, then they have to give it back, and then that money isn't available for them next time around. So I'm pretty confident we'll be able to get this done. Also related to that, we have received the surveys. Finally, we hired the Hospital Council of Northwest Ohio to survey people in all three counties. They surveyed 1,200 people in each county, and we asked them information, or we wanted to know what people knew, get some quantitative data about, these are the prescriptions I've been used, this is how often I have misused a prescription. Everything was anonymous, so people could be honest. I did have to do some extra reassuring in one of our communities that yes, these are truly anonymous and we are not tracking you somehow mysteriously. So we're not sharing those survey results yet because that second or third page says these are available on these websites. They're not available on any websites yet. So we probably should get them on websites before. But I have some highlights, I guess, from the data. One of the things they looked at, and this is specifically Lake County, with a number of...
How many respondents from Lake County?
We had a 33% response rate in Lake County.
And how many were sent out?
1,200 of them.
So about 400 people? Okay.
So it's a sample size big enough that they are confident it's representative of the entire county. So looking at the, and help me opioid people, then our prescribing rate for the risky prescribing rate, so higher than 90, is that right? 90 MAD. Our rates in Lake County have been steadily declining since the third quarter of 2014. We had one quarter where it briefly went up, but it's been on the decline. This is really important. We also surveyed our law enforcement, behavioral health, different groups in the county and in the other 2 counties about their perception, what we need, what we have, what we don't have. And one of the common refrains, especially among the law enforcement in Lake County, is that the docs just keep passing that stuff out like candy. That was the comment that showed up word for word on more than one of those questionnaires. And so in actuality, our docs are prescribing far, far, far fewer opioids than they have in the past. It's been dropping constantly over the last few years. For those risky prescriptions, we are, ever since the third quarter of 2018, our prescribing rate is actually lower than the state as a whole. So good job to the docs.
Yeah.
And good job to the people who are making the docs.
In 2018, for EOCCO plan members, analgesic opioids were still the highest number of scripts written.
Yeah.
In Lakeview, I didn't look up north.
Are you rated an arc rate?
Yeah.
Well, actually, in bringing out the cost and utilization reports, you can actually see the decline across the region too. But in some counties.
Across the country.
Yeah.
Yes. Okay, so if you are part of the consortium or were at the older adult meeting earlier today, don't answer, but I have one of the questions for you guys. How do you think that people are getting the prescription painkillers that they are abusing? What's the most common way?
Online.
Okay, what else?
Friends and neighbors.
All right, we asked the people that in the questionnaire. Their perception is that 19% of the people who are abusing prescription painkillers are stealing those drugs.
Stealing them?
Yes.
That's their perception.
That's the perception.
Okay.
The next, number 2, they think that most of them are getting them from a doctor. Then number 3 was friend, number 4, family, and then number 5, they think they're buying them from a dealer somewhere. In actuality, the people who say they've been abusing or have abused prescription drugs, almost 60% of them are getting them from a friend or a relative for free. And then the next highest is from one doctor, and number 3 is from a dealer or a stranger. That's just 3%. And none of the people who reported that they had abused a prescription painkiller had stolen those drugs. So our perception is far different from reality. This is the one, I don't know, I was shocked at this, but I think I might be the only one, so I'm gonna throw it out to the larger group. People were asked to respond whether they strongly agreed, disagreed, or strongly disagreed with this statement. Drug and alcohol addiction are diseases, and 26% of people disagreed or strongly disagreed with that statement. So there's some education that needs to happen around addiction. So.
Was there a follow-up there? That's a moral failure, is what we're assuming?
We don't make assumptions from data.
Well, that's why I asked if there was a follow-up question.
Yep, no follow-up question on that one.
Do we have that based on age or sex?
Not broken out, like I don't know how many 40 to 50-year-olds said this on this question. We do know who responded to the survey overall. We have that data by age, I think by gender.
I wonder if we ask the same question to the same people. Do you think mental health is a disease? Or if mental health is a lack of mental health is a condition? Same kind of question.
I'd be interested
And I wonder if the same answer, or if the same people are responding, mental health illness is not a disease. Mental health, not everybody understands that mental health, just like having diabetes or having a heart condition or having hypertension or whatever, they're all diseases. But not everybody understands that, so that might be slightly misleading to assume that because we targeted one condition, that people don't understand that.
Our survey was based on surveys that they'd done previously and data that they gathered from those. And they gave us a list of questions, and we were able to narrow them down some. But we didn't really create any of our own questions on this because of the history that they already had with it. And yeah, that might have been, I don't remember seeing anything about that.
We didn't want to, because in future, if we do a
Right.
post-survey, we want to use the same
That's right.
questionnaire so we can compare national and state.
Exactly.
data.
Almost all of the questions we asked came from CDC or, I don't remember all the others, but they came from national surveys.
And we couldn't even change the wording on
No.
it.
One of the key things we want to do is think about, now that we have that information, what do we need to do to change understanding? And how do we educate the public so that when we do a post survey, that we have made a difference and help people say, no, that is a disease.
It'll be part of strategic planning.
Well, a lot of them did, Charlotte.
Pardon me?
It was only, what, 27%?
26.
26%
Right.
that didn't think it was a disease.
Right, so
Almost
Still
one.
wanted it, right.
That's almost a third of the population not quite understanding conditions. That's a huge misunderstanding.
And we would address that in the programming grant because we would do media outreach and everything. Unfortunately, under this grant, we can't use those dollars for that. Even though you're like, wow, we know that, let's address it. We just don't have the capacity to right now.
Yeah, additional, that's it. Okay, let's take a moment just if anybody has any public comment for the good of the group.
We do updates on what everybody is working on.
Yeah, do that.
Last bit.
Sure. We are really nothing, just trying to
Well,
keep going. I'm worried, I totally was not prepared. Where do I even go with that?
Just anything anybody needs to know.
Why did you start that way? No, we're getting ready, school starting up. We're going to be in the schools. Like I said, we've spent the whole summer working on immunizations, not only the 2 and younger, but we are now, with our alert system, I'm able to pull very specific data from it that we can call, and if they have phone numbers still, and we're doing a lot of callbacks now that we've never done before, scheduling online. About half of them show up, but still it's half more than what we had before. And we're doing some staffing changes over there, so whoever answers the phone is going to be able to help you, and we'll figure that out when they get there. And that's about us for now.
I don't have any real news, but to clarify, if I didn't get to this last time, we have new granting situation. We are trying to help some folks get medical appointments, even if they don't have OHP. So we do have a bit of ODOT money that we are helping folks get to transportation, even out of the area, once or twice a month. We're still trying to piggyback most of those folks onto non-emergency medical transports through OHP or through VA. However, we are picking it up and trying to get other folks to their medicals. So please have them give us a call. And we've been working well with the healthcare coordinators trying to close those gaps for those folks who don't have OHP but still have serious medical issues that need some help out.
Is the term taxi voucher what you use?
we do not have any taxis in this county. So what we've got is just trying to figure out a case by case on what they call is an on-demand service, which doesn't mean we call it 15 minutes and say,
Right.
oh, my mother needs to be at the clinic in 15 minutes, and the clinic was supposed to call.
It's the Lake County Uber service.
As much as I would like to see that, be able to expand that service, I can still hear all the screaming from Fort Rock, well, why don't you have Uber here? So, but that will be nice, but we don't have that yet.
I only asked that because Liliana heard about something up in North Lake where somebody's giving vouchers for.
It's not, and I could be confused because I'm still getting familiar with Lake County, but isn't there a system that they're paying for people to go either?
There's big gas cards.
Yeah,
Like gas
Yeah, we've done gas cards for
Yeah.
developmental screenings and stuff.
Yeah.
To open accessibility for those, to keep costs as being a
I
barrier.
was, but I was wrong thing.
Okay.
Did the gas cards never go to public health?
We don't.
Is there a reason that they could never go to public health in North Lake?
I think there was something being worked out over there, but they do have vouchers for people that cannot get a transportation, and they're not necessarily given to developmental screening patients. It's just patients that need to get to appointments that do not have the services that we have. For example, Gobi. If you go to public health, we could set up a Gobi transportation for you. But North Lake doesn't have that, so that's why they get the gas vouchers. And the Lapine Clinic is the ones that are assigned to give them out. There was a misconception that they were giving it to their clients as an incentive, and that's not what they were for. But I think that is being addressed from what I hear. They're doing some staffing changes right now, so that might change. And we might get some in the public health up in North Lake.
And there's a separate voucher, so in down, all of the clinics and public health are giving diapers for parents who bring in their kids to complete a developmental screening. In North Lake, they also get a $10 gas card as the incentive an added incentive to drive all the way to Christmas Valley.
But on that note, we offer to go pick them up here. We will go pick somebody up if they need a ride with our car.
For the developmental screenings,
The Gobi does transport people.
Yes, and we are able to call them and set up an account for them and have them talk to a representative, because they ask for that beforehand. And then when they come back, we can fax everything or email everything and kind of get them set up with it.
We do have 2 drivers in North Lake, so yeah, we're serving North Lake as well. It's the Paisley area, which is served by a different group through the ICFC, which is, I don't know how that works. They just volunteer drivers and gas reimbursement. Bonnie Lindsay used to have one of her black boxes.
For advanced dental, I think, so I was working on just kind of getting the word back out to the community that we are open again. We've got a provider as of April 1st. And where we are, I think we put something in the newspaper, biography for our provider, Dr. Herman. And then I asked our home support office to put something on Facebook, because I know that Lakeview uses the announcement page quite a bit. And currently working on the diabetic and sealant metrics. And that's kind of what I'm focusing on right now.
So,
I've seen the numbers.
so Advantage had a pilot project grant to do tele-dentistry with an advanced practice hygienist who can do scooping, not drilling, but scooping and cleaning and all those kinds of things. And it's operational now in Condon and Arlington, and should be available in Morrow, M-O-R-O, the town, next month. But the system that was built there would allow for, you know, in remote settings, going to a Dell or whatever and seeing folks. So.
We're doing it in Kalanda.
Pardon me?
The teledentistry. We're doing it in Klamath as well.
Oh, okay,
Because
great.
we just got a provider there, I think 3 Fridays a month. So.
When will you be out of the?
What?
When will you be out of the van or the?
Fall.
Will then there be
That's a month away.
Right?
Well, like November.
Oh.
What's
Okay,
with the
that's 2 months away.
facilities then, when you move into a permanent building, because right now you don't have
We
X-ray?
do. We do. We don't have a panoramic machine
Okay.
for like extraction of wisdom teeth, so there are things that we're not doing in the mobile unit, and that's for our provider. Root canals, stuff like that. Some extractions we are not doing in the mobile unit as well, just because of maintenance issues, kind of. It's not steady and he's not comfortable. Yeah, makes sense. So things like that, we were referring out and trying to keep the funds in-house.
So brought you all a patient that we couldn't get X-ray, but maybe because we couldn't get her inside. Okay, never mind it then, yeah.
So there, and I think I did just order a sign, because we're kind of, I don't know if everybody knows where we're at by the public health building. So I did just order a sign to.
That'll be great. They
Put
come in
out.
every day and ask where you are.
Yes,
Yeah.
So, well, so if anybody knows, I don't know, the sign that I asked to be ordered, the parking word is a lot bigger than Advantage Dental. I don't even know where our parking is.
I think just on the street.
A lot of people park in that grass. I don't know if that's okay.
I don't know either.
You might
So I
also
didn't want
want
to
to,
put that sign.
you might
up.
also want to check with the town to make sure there's no requirement of having the sign approved,
Okay.
just
Okay.
as a suggestion.
Okay, thank you for that. That'd be great.
Because sometimes they get grumpy. I know.
The AdPep, that's me, and the new TPEP, that's Ariana here. And the TPEP in North Lake, which is Lily George, just came back from a regional confab there together, and we're just working on this. Both schools have asked us about vaping because it's such a big issue, and there's so much misinformation. And so we worked something out with North Lake, that's the first one. We have a date set, we're getting all ready, we're gearing up for that. And we've got what we want to do approved through the school. And we're just looking at fall and trying to make sure everything gets ready to go with all the, different programs. So that's it for me.
We just basically got through our little push on our school physicals. So probably after school starts, we'll go back to business as normal, but I think they've been doing quite a few of those between Pop Warner and athletic physicals, but I don't think anything new.
Oh, I can't, no. I do want you guys to know I take this stuff to heart now, and I do take it back to my participants. And so, I push and ask, did you do this? Did you do it? Oh, you're not on WIC, let's call. And so I really do pay attention. And
We never doubted you.
I don't know, Charlie, you seem to be doubting me. No, but I think it's great, and I think the more we all work as a team, the better. And I do want to say one thing about the dental exam for people with diabetes. I know, I have a family member in particular, and when you guys brought this up in a meeting a few months ago, so I said, do you go to the dentist? And she says, well, no, I have dentures, well, I could go to the dentist. And I said, well, you need to. So I'm not sure if she's one of the two that actually did it, but if not, I will be asking. Yes,
Yes, good job. Thank you.
So, a lot of people who I think in this community are older with diabetes, and if they have dentures, I think they believe that they don't ever need to see a dentist.
So, for the cancer.
Oh, I know, but they don't, I mean, they're.
Again, that's an informational thing that we need to work on messaging for people to understand that. Just
Or we
like
could maybe hang something on APD's window, you have diabetes, you should go have a screening.
At the crisis center, we're working on a sex trafficking training and awareness. I've been
Teaching people how to?
No, the Marines in Camp Pendleton do that.
What?
Oh, now.
It's basically last year, I attended the one that Marta's House in Klamath Falls put on, and it's great. And so I've been in touch with the state trafficking coordinator. And so in order to have it happen here, I need law enforcement to request it. And I've spoken with one top law enforcement officer here, and he doesn't believe it's occurring here. And so he does not want to request the training. I can still coordinate a training here, but it will be more of an awareness and not a training for law enforcement on how to identify sex trafficking. So that's something I may do. Marta's House is planning to have their trafficking training again. I think you were there last year, but they're going to up their training. It's going to be part on September 10th. That's the tentative date. Excuse me. And the first part will be for the community and advocates. And then the afternoon portion will be for law enforcement. So if I can't bring that here, I'm going to encourage law enforcement to attend their training, but also once I have the flyer, I'll share it so that anyone in this group or other community partners can attend it.
Can state police request it?
He's not interested, so.
Stop me if I'm wrong, because I know you know more about this. I just want to prime the pump here. My understanding is that this is more of an issue, but that it is a kind of under the radar a little bit, in that the families don't want to report it. They don't want the girl to be ostracized or stigmatized because of it. So they might fetch their daughter or whatever and bring her back, but nobody reports it or says, is that why the law enforcement thinks it's so low?
It's been reported, but they don't believe it's actually sex trafficking. That what I was told, that it has to do with, you know, these girls going down to Modoc and having some fun, coming back and then having to make up a story for their parents not to be upset. That's what I was told, which I don't believe. From the state trafficking coordinator, she has received reports from the National Sex Trafficking Hotline specific to Lake County, and so they're taking that seriously, and I did talk to that, you know, about that with Sheriff Taylor, and he just doesn't believe that. And so, you know, I'll take baby steps, bring the awareness training here for those that can't attend the Klamath one, but I'll share the information when I get the flyers for anyone who's interested in attending. But I'm working on Jay Career. He can request it.
Oh, okay.
If he calls me back, so. So it's hard to get.
You have an in.
So let's Judy and Lori, can we talk later, like via email?
What was that?
Let's talk via email. Building community will that lets the officers know that this is something that is important, because maybe it's not on their radar, but if the community shows them that it is, then I think that's there's a couple of other issues.
There might be many ways that we can provide
that would be
information
great
to
if we
change
can
that.
think of it, yeah.
Those that don't know, there's now documented sex trafficking in every state, every county in the country. And anybody that doesn't know that, we just need to provide them education.
And sometimes sex trafficking is not identified when there's domestic violence. And I've had clients who come in as domestic violence clients, and then after, you know, doing the intake, it turns out that they've been trafficked by their boyfriend or their husband. And so, you know, it does come up, but hopefully, you know, I'll get it done. And I was hoping for the end of September, not sure, but Klamath will do theirs on the 10th. If I can do a back-to-back with the same trainers, they'll come from Portland PD and some FBI trainers for this, then, we'll try to do it that way. But I've been working on it for a while, so it wasn't something that I just started on. It's just trying to have someone request it, and it has to be law enforcement.
Even if it's correct that it wasn't happening in Lake County, which I think that's not the case, the fact that we wouldn't do the training because we didn't believe it wasn't happening here isn't an excuse.
Right,
fact
well,
is
that
you want
was
the
the
training.
excuse that I got.
Yeah.
Maybe we can provide some assistance in that.
We can
Just to move things
have a
on, because we're just
conversation.
about out of time. I have one thing I want to say on behalf of the Mental Health Department, our Wellness Center. Next week, we have our, on a positive note, suicide prevention program. So I hope people will come and learn more about the indications. It was a good success last year. We did that in partnership with the VA. We'll be doing that again, but please tell people, and that's a good thing.
Very good. We will have a
The next meeting will be held on September 12th, so we'll look forward to seeing you all then. We're going to adjourn the meeting. Thank you all for your time.
Thank you.